Always great catching up with Dr. Susan Kahn. Dr. Kahn, how are you?
I'm doing well, thanks. How are you?
Doing well, thanks. Dr. Kahn, of course, the director of CTAC, the Center for Excellence in Thrombosis and Anticoagulation Care at the Jewish General Hospital. And Dr. Kahn, AstraZeneca making headlines yet again. We've spoken recently about its efficacy, how safe it is, despite recent concerns about blood clotting, but now the age group has dropped. What explains the government's decision to lower the age eligibility for the AstraZeneca vaccine from 55 plus to 45 plus?
Sure. So I think it's increasingly clear, especially with the explosion of COVID infections recently due to variant cases in Ontario, but also in Quebec and elsewhere, that really the top priority is to vaccinate as broadly as possible to prevent COVID infection and also prevent severe COVID outcomes. And these outcomes, severe outcomes, tend to be far more common in middle-aged and older adults. So I think dropping the age limitation to 45. The rationale for that is to vaccinate more broadly and also recognizing that these vaccine-related blood clotting events remain extremely rare events, and they should not preclude folks who are eligible to be vaccinated from getting their vaccine and preventing COVID infection.
Now, you're obviously a thrombosis expert, one of the top experts in your field. For somebody who has history with thrombosis, what do they need to know about the limitations that may or may not exist, especially in this new age category, about whether or not they should be seeking out this vaccine and taking it to prevent COVID-19?
Sure. So, definitely we're getting calls from patients to our own thrombosis clinic here with exactly that question. And what our recommendation is that you should go get vaccinated, including with the AstraZeneca vaccine. There's been no suggestion that folks who have had a thrombosis in the past or who have thrombosis risk factors are at any higher risk of getting this extremely rare thrombosis events that can occur with AstraZeneca vaccine compared to folks who have never had a thrombosis in the past or who don't have thrombosis risk factors. And the reason for that is that the mechanism that seems to provoke these rare clotting events after AstraZeneca vaccine, it's a different biological mechanism altogether. It relates to an immune reaction that can drop the platelet count, can cause activation of platelets. That's one of the component of the blood cells after the AstraZeneca vaccine. And that's a totally different mechanism that occurs with other types of blood clots that people may have had in the past. So we strongly recommend that even if you've had a blood clot in the past, you should get the AstraZeneca vaccine. And the only exception to that would be a very rare complication that can sometimes occur after heparin therapy, which is a type of a blood thinner, and that's known as heparin-induced thrombocytopenia. Again, it's a rare reaction to heparin. If anyone has had that reaction in the past, then probably they should not get the AstraZeneca vaccine. But aside from that, anyone, whether they've had a history of thrombosis in the past or not, whether they have thrombosis risk factors or not, if they are eligible based on their age to get the vaccine, they should go ahead and get vaccinated.
Have we learned anything new since the last time we spoke? I know you had, cited some UK data. We've learned a little bit more, I suppose, in the short time since then. But is there anything new, especially, as it pertains to Canada, that changes your opinion at all on it? Or are we really, staying with the same line of thinking as we did, say, 2 or 3 weeks ago when this started to become a real conversation for people?
Sure. So I think it's about the same line of thinking in terms of the rarity or the rareness of this complication. One thing, though, where we have made a lot of progress is that there have been groups of thrombosis specialists who have been convened and are sort of ready and waiting. If any physicians in the community have any questions about their patients, we're available to provide expertise to them. And the one thing about these unusual or rare blood clots after the AstraZeneca vaccine is that we know how to recognize it, we know how to make the diagnosis, we know how to treat it, thereby, improving outcomes. And in that regard, I'd say we're farther along than we were a few weeks ago when this complication was just described for the first time. Okay. So I feel that we're well armed in terms of our knowledge and knowing how to manage the patients should this rare complication occur. So patients can be reassured in that regard.
Last question for you, and maybe you've answered this in part already, but what would you tell anybody? And I know there are people who are thinking this way. Maybe they're still shopping around, I guess you can call it, for vaccines and may prefer to wait for one of the other vaccines to become available for this current age group.
Yeah, I would not shop around. I think we have a vaccine, the AstraZeneca vaccine. It's effective, it's safe. There has been a description of a very rare complication that has emerged. You know, the rates of this complication are really no different than adverse events that can occur with any medications that are already on the market. And I think it's misguided to, wait around. Who knows? By the time another vaccine is available, 4, 6, 8, 12 weeks from now, you may be in a situation where, unfortunately, you've caught COVID and you're now in an intensive care unit on a ventilator with a much higher risk of developing blood clots than had you taken the AstraZeneca vaccine. So I think it is a wrong decision not to take the vaccine if you are eligible based on your age.
Dr. Susan Kahn, Director of the Center of Excellence in Thrombosis and Anticoagulation Care at the Jewish General Hospital. Thanks so much again for taking the time. Nice chatting with you.
Thank you very much. Bye-bye.